I was spending a lot of time trying to work out how do I find a service that can help everyone get 1% better every day. Couldn't find anyone that did it, found lots of services that were offering access to therapy and kind of coaching, but there wasn't much measurement and there wasn't much understanding of self. There are about 1.8 billion people in the world every year that could benefit from some psychological advice. We need personalized psychological advice. But how do we do personalized psychological advice at an enormous scale? First thing we need to do is we need to create the world's most trusted brand for personalized psychological advice.
Hey everybody, this week I am delighted to be joined by Charlie Wells. He's founder and CEO of HelloSelf, and in what he calls his before life, Charlie studied neurobiology at Oxford, moved to London to work in healthcare marketing, a man after my own heart, but then in 2011, a life-threatening brain hemorrhage changed everything for Charlie. He survived the coma, pioneering surgery, and then decided to make the most of what he describes as his second chance, focusing on personal well-being, relationships, and making a positive impact on the world. So, HelloSelf was founded, responding to the growing demand for mental health services, of course, we're all aware of. HelloSelf helps people feel better, faster, and stay better for longer. They pair individuals with therapists through a clinical matching team, designing therapy to fit unique needs and extending progress between sessions through their app and their platform. So Charlie, an absolute pleasure to have you on the Healthtech podcast. How are you doing?
Great. Thanks for having me on today, James. I'm excited to have the chat.
Yes, you're very welcome. There's so much that we can talk about here. I mean, you've got everything from, for a guest on the Healthtech podcast, you've got a neurobiology background, you're a founder, you've got a personal patient story in healthcare that's led you here, you've shifted priorities, you've kind of done it all. So I am incredibly excited to hear this from you. Before we get going, whereabouts are you based? Where are you speaking to us from?
I'm just at home in London today. So I grew up in the middle of nowhere on a farm, and I always assumed my life would be in a woodland, but I've been in London for 20-something years, and I can't see myself leaving anytime soon.
Wow. Grew up on a farm. That's really interesting. In fact, we can perhaps make that the start of your story. The way we start these is for you to tell that story. It's a heck of a story, and I might jump in and ask a few questions on the way. But let me give you the floor, Charlie. How did you get here?
Who is Charlie Wells?
Who is Charlie Wells, indeed?
So I guess a good place to start. Yeah, I grew up in Kent on a fruit farm. I enjoyed science. I wanted to be a doctor, but because I thought that was a good way of helping people, and because some of my friends' parents were doctors, so so they were impressive. My father was a management consultant. My mum ran the farm, and you never want to be what your parents are, right? So I thought I'd be a doctor. But found actually I wasn't very good at being a doctor. I did lots of work experience, and actually just found being in hospitals quite hard. Like emotionally, I found it like being around sick people all the time. I just didn't get much positive energy from it. So everyone said you should be a surgeon then, because you don't have to deal with the sick people. But I actually decided to I got really into genetics. And so I went off to uni thinking I was going to be a geneticist. So I did biological sciences at Oxford, thought I'd be a geneticist. This was in the late 90s. So, Dolly the sheep, everything was about genetics. Like it was all really exciting. And so loved biological sciences, but found out you have to do the kind of big stuff as well as the small stuff. So spent a lot of time in fields and watching birds and like understanding ecology and evolution when I was really interested in genetics, cell biology. I got really specialized over my 3 years and ended up specializing in disease, genetics, and neurobiology. So I built viruses that infected neurons, in fact, which was my thing. I got really into building viruses. I actually built like the world's 5th most virulent virus at one point, but
what a claim to fame that is.
Exactly.
And it didn't escape the lab, so crucially, I imagine.
Exactly. The world's been academically interesting over the last 5 years for me.
Just out of interest, how does one build a virus?
Oh, that's a whole podcast in itself. But a short version is you find which genes you want. You chop those genes out and put them into bacteria in plastids. They're like circular pieces of DNA. You can obviously breed up the bacteria. You then put markers on them so you can tell whether it's worked. So you can either put kind of glowing proteins or various other things. This is obviously in the 90s. It's probably much easier these days. Then you chop those out. And I was building baculoviruses, which are viruses that affect insects. And they have an advantage of being very big viruses. So they're easier to get stuff in, and their plastids are a bit simpler. And then you can use those kind of genetically modified viruses to infect cells. So you have to change. We were adapting insect viruses so they could infect mammalian cells. Sounds a bit reckless when you think about it that way. And then we were putting them in rabbit cell lines to try and create antibodies to proteins. So I was actually working on hepatitis C proteins to try and work out how do we get hep C antibodies. That was my kind of final year project. And I was quite into it. It was quite interesting. But and so I was going to go off and do a PhD at MIT was the kind of goal. But I actually found pipetting a bit lonely and a bit slow. Like nowadays, genetics is much faster, but it would take 4 months to do a project and like a year to get results. And I'm impatient. So much to my father's heartbreak, I didn't go off to MIT and do my PhD because he was living in Boston at the time, and he thought that'd be great.
Oh, wow.
And I basically decided to try and be Sir David Attenborough for a year. So I thought, I'm going to communicate cellular biology to the world. So I'm going to do what David Attenborough does, but for cell biology and genetics. And I tried that for a year. And as you can see, I failed because he is still he and I am not. So that was my first attempt at kind of failure. But it really got me into kind of communicating science and explaining complicated science. Because I think even today, I still think we don't have sort of the language of science in our kind of culture enough. And I think it's a really interesting way of helping people understand first principles.
It is actually, and just to jump in and interrupt you there, I think this is. I think you're absolutely bang on here that we just don't have enough of that scientific language in our everyday. I think we're at an interesting point now with the rise of certain, I guess, influencers. We're getting more clinical influencers. We're getting more of the kind of lay influencer that are sort of pseudo scientists almost that will find one paper on something and then base their entire like argument on that one paper, or perhaps a couple, or maybe they stumble upon a meta-analysis. I don't know, and you know, hang their hat on that. It's probably a better version of that. But my point being, I think we're at a really confused place right now with people that definitely understand the science because they're academics, and then you've got clinicians that sort of lean heavily on academia and read a lot of academia and understand and dip into it where they need to. But then there are people, particularly in healthcare, that are reading perhaps the odd thing and basing opinion on it. And then there's people that just give into an internet article that isn't referenced and then base on that. I know you're probably going to go on to talk about a comms background, but like, what's your view on where we're at right now with science and language and communication? Because clearly, well, for me anyway, I think we're at a very confused place, and there is no individual or organization or brand that I think people can gravitate to go, at least I can get the answer from there. That's, I guess, my hypothesis.
I completely agree. I think your analysis is very good. One thing I find really interesting that's happened over the last 20 years in sort of science is more and more people have piled into science, and our kind of specialisms in science have got more and more specialists. So people have, become, in my day, you'd have like a cell biologist, and now you have like a lysosomal biologist, and then you have a sort of micro. Yeah. And so you get all these kind of more specialisms. But that specialism means that there's less people telling how that whole thing fits together. Like how does like the cell actually work? Because actually it's quite complicated now. There's so much knowledge. And so we end up having this kind of very top level false view of, because it's such a simplification, it's sort of almost unuseful. And then we have all of these kind of really kind of deep specialisms, but we're not very good at kind of creating a narrative that allows you to go up and down between the detail and the high level. And that's partly because, this is where I insult half the population. Like a scientist's mindset state is not about communicating systems. It's about defining a testable hypothesis and then building the kind of data to set that, rather than being interested about how these hypotheses might interface with. And you're starting to see a bit of a movement now coming to a bit more like systems biology, in like environmental biology. I think is really interesting, like Earth health, because you can't do Earth health one by one. And you're starting to see that in sort of human health and human biology, because you can't explain a brain with just a neuron, right? You can't explain psychology with just neurobiology. So I think we're starting to see kind of more sort of system science, but it will be interesting to see how that evolves. And it certainly needs to be much better communicated and much better understood in our school systems, in our political systems, in our decision makers systems, because it's still dominated by a kind of more academic sort of classical education rather than a scientific education.
Yeah, because I see sort of Brian Cox from like a physics and astrology point of astrology. Is that the right word? Is that the weird one?
I think he calls himself
astrophysics is, I guess, where I'm going with this.
Exactly.
rather than are you a Gemini, etc. And what's your personality? Yeah, it's interesting. I don't see that. I don't see that figure. I don't see that character in biology, and I think that definitely is a gap. But I did interrupt your story.
There's still time. Maybe I can still fill that gap.
I think there is still time. I think there is still time, and who better in a lot of ways? You clearly have a passion for it. So why not?
So where to get to? Obviously, it didn't work. Mainly, I'd like to think not because of my inability to communicate, but actually visually in the early noughties, it was quite difficult to work out what do you put on TV, because like a lion running across the field is quite exciting, but what do you show as a kind of visual cell biology? It was quite tricky. I needed some money because I couldn't afford to not eat. So I ended up getting a job at Ogilvy and Mather, which is an amazing advertising agency, on their grad scheme, because I was interested in communicating, and I thought advertising is close to TV. Maybe that's a good place to start. And because I was a scientist and interested in reading papers, I got given healthcare accounts. And it was the right place, right time. This was early noughties, so everything was becoming science. So food was becoming science. So yogurts were all about probiotics and what that meant for gut health. Beauty was becoming science, so it was all claims based. So I ended up working on GSK and Unilever and Nestle and all these sorts of, and I found that I was kind of given the jobs where someone had to read a scientific paper and then try and put that into a kind of proposition, working with the clients, and then get that through regulatory and making sure it was sort of truthful and data supported, and then obviously making comments off the back of it. So I did a lot of launching of OTC drugs. If you don't know what that means when a drug was sort of a prescription-based drug, but was now being allowed to be bought at a pharmacist, things like Zovirax and sumatriptans for migraines. But I also did things like sort of toothpaste and probiotic yogurts and Munch Bunch and things like that. It was when we were trying to take sugar out of Munch Bunch and make kind of health claims. And I loved it. I really, really enjoyed everything we did, from sort of TV to digital to sort of 360-degree marketing. But it was while I was there that I was kind of in my free time, I was a sort of musician in a band, and I was spending a lot of time on MySpace. I was doing a lot of things on the internet, and I was a big believer that the internet was going to be a big social system. It was going to be a big people connecting with people, not a kind of broadcast platform, which is what advertising was assuming it was going to be. And no one would listen to me at Ogilvy. They kept saying, yeah, that might be the case. And then an amazing chap called Rory Sutherland, who's super famous in the advertising world, who was my boss.
Wow.
Yeah. I still, so I was...
Is it your direct boss, like one person away?
Yeah.
Wow.
I spent a lot of time with Rory.
That is awesome. That is awesome. I see loads of his stuff online. I follow him. Yes. Avidly.
He's a good egg. So I actually was very lucky. I was at Ogilvy at an amazing time. I had Rory as a boss. I had a lady called Sarah Newman, who's the chair of the APG now, who's the head of planning, one brilliant planner. I had some really fantastic creatives that I was working with, Richard Russell, various other people who wrote some of the world's most famous adverts, like Hate Something, Change Something for Honda. So it was a really kind of hot moment. So and actually, I was talking about how the internet was going to be different, and I was pitching it to Rory, and Rory actually said, "Look, I actually believe you, but we're a massive organization. We're not going to take a bet like that until that starts happening. Like, we're not the kind of the super early first mover. But if you believe in it, I will be your first client. And so I quit the next day, and Rory became my first client. And I built him a product called Ogilvy Brains, which was it was a bit like a kind of sort of very fast Twitter, whereas rather than briefing to a single creative team of 2, you could kind of create these briefs and send them out to the whole world of Ogilvy's sort of hive mind network, and people could just throw in kind of creative starters for 10, and then that would go to the creative teams, give them loads of material to start thinking about. And the idea here was, how can we use like the collective knowledge of an agency, which gives them competitive advantage over small agencies, rather than like just 2 people in a room. And I started to realize that you can connect people in really interesting ways on the internet. And that's when I got obsessed with ants models, actually. So I basically decided that social networks were going to be similar to social insects. So ants' nests, beehives, etc., where you see different kind of tropes of behavior. And so we identified like 7 kind of meta behaviors that exist in all social systems. And we built a kind of platform to try and model where was there going to be healthy and unhealthy behavior in social networks. And as you can imagine, I started worrying that a lot of the way we were building the social internet didn't conform with the way that social systems work in the real world. And hence you get rather sort of toxic behaviors online. And so we built loads of, so I started a business called Kinship Networking. We built a lot of technology platform to build these kind of networks. I built about 300 different kind of networks and communities on our platform, some really big. Like we did everything from like pet social networks. We did a social network for female entrepreneurs in the Middle East. We did all sorts of interesting things. It was really fantastic. It grew really fast because actually it was a rubbish business, but it was like the right place, the right time. And so it grew fast because social media became a thing, right? And then we sold that in 2010 after having some amazing experiences. Like we did a project for Sneakerpedia that with Shape It Nitro that won like Cannes Gold Lions in advertising. That's a big deal.
Nice.
We did we did some strange things. We helped Facebook launch into the UK. So I had like lunch with Mark Zuckerberg and his mum on a couple of occasions, and his bodyguard, and helped that come into the UK. So like it was all sorts of like, it was a really good time to be in the social media space. Everything was possible, and everyone believed it was only going to have positive effects. So it was quite kind of exciting. And then, I sold that into 2010 to Shape It Nitro, which was the company we'd been working on with Sneakerpedia. Because they were so excited by that, we ended up coming together and rolling out a kind of social creative consultancy globally. So it was super exciting. Went from 20 odd people to several hundred people in a few months. I had teams in Miami and India and Singapore and London, clients everywhere, using our kind of modeling technology to try and predict better behaviors, but also to work out how does kind of marketing work in a new social platform. So it was good. I was 29 years old, and like what was my title? I had something pretentious. So like vice president of social strategy globally or something, and director of marketing strategy and analytics for Europe or something. But basically I was young and like running fast at things, and in a really big American company, and everyone assumed that should be like a bad part of my story, because like what entrepreneur likes to be bought and have to work in a big kind of American company. But it was brilliant. I learned so much about like scaling quickly and reporting and running a P&L and P&L with lots of zeros and target setting. They were a very driven organization with very short-term structures. And I was quite good at that too, but I guess my real heart was in the kind of inventing space. And that's when I had my life pivot. So that's life number 1. I'd just been married. I was 30 years old, and everything changed. So, I mean, any questions on the first half of my life, or shall I go into the
obvious one? The obvious one is what was Mark Zuckerberg like? What did he order for lunch? How did he eat? Is he actually an alien life form, or do you think he is human?
So I've met Mark on lots of occasions, and he is definitely not an alien. He's very, very smart. He is very analytical and inquisitive. He asks very good questions. He's much better these days. He used to be mildly socially awkward in the early days, but he interestingly, he got on with us really well because he thought we were all developers, and then he found out I wasn't a developer, and then he instantly became more awkward with me. So
interesting.
If you have an engineer's mindset, like Mark is couldn't get along with anyone. If you approach things without an engineer's mindset, he finds you complicated to get on with. But this was, 12 years ago, 15 years ago now, right? So he's been beautifully media trained, I suspect.
So your story just accelerated quite rapidly there. You went from having an idea, talking about your views and opinions on social media and the structure of it and how people would use it, to then essentially having an idea, starting a company, growing it to exit. There's so much clearly in that journey. And partly, as you say, like the working in that company, what you've seen, the belief that it is possible to grow a company that big and to operate a P&L with that many zeros must suit you incredibly well for the future. But with that part of your life, I guess, do you have any learnings that come to mind of how to do that so quickly? I know that you said you were in the right place at the right time. It was a bit of a, tongue in cheek. It wasn't a great business. That's still really interesting to me because you've still managed to grow it and exit it, even if, of course, everyone looks at their own business and knows that there are problems. But what comes to mind for you, I guess, if I was to ask about the reasons that it did grow to exit, what was it about that company, or indeed you leading that company, that led to that growth?
Listeners who know me are going to laugh because I always answer everything with three things. So I can't hold more than three things in my head. So, I mean, obviously a huge dollop is luck, as you said, like being in the right place at the right time. But you do make your own luck by the second thing being infinitely curious. So I think too many people in life in general lose that kind of childhood enthusiasm to think about what is the world like? What's it going to be like in a few years? Like, how's this going to change? How could this be better? Like, how do I learn new things? Like, I was a neurobiologist. I had no right to be playing in development in social media, but the internet was changing. It was exciting, and I was young, and so I wanted to understand that and be part of it. And still today, I want to play with new tools, be interested in new things, like understand new problems. And so I always tell everyone that you should become obsessed with problems, not obsessed with solutions. So like if you get really, really interested by how things are changing or where there are problems, and not sort of evangelical about your particular solution, then you can be really curious and understand things really well. And then I guess the third reason why it was lucky is when you see opportunity, you need to move fast on it. So you need to kind of fearless on moving there. So like most people I know, when Rory made a kind of quip about, you believe this, if you really believe it, go and do it and I'll be your client, probably would have thought about it for a bit. I resigned the next day and said, right, and then held Rory to that, right? And that was probably reckless. I was 26 years old and I needed the income. But because like I kind of got Rory to commit to some money, I knew that I had something I could land. So it wasn't so reckless that it was like, I'm going to start. Absolutely. Today it's all very good. Let's start up in a room for a year and never have any revenue. I had some revenue. So I took the early revenue and used that to kind of invent what I wanted to invent. So take your opportunities, be tactical, and strategic in equal measure, have visions of the future, be super curious. But be relatively bold in your decision making, bold or reckless, depending on how you think about it.
Well, there's only so reckless you can be at 26 years old, actually, to be fair. If you're a 26-year-old that doesn't have a young family or other commitments and that kind of stuff and mortgages to pay and all the rest of it, there's only that is a kind of a beautiful time to do it in many ways.
Oh yeah, I mean, you're now talking to a 43-year-old man with two kids, and mortgages and the rest of things. It's much harder, but to be reckless. But I completely agree. I mean, I always tell young people, like, and they're saying, "What should I do?" I was like, "Leave university, go work somewhere for 2 to 3 years they've got the best reputation in the world. Go work at an Ogilvy or a McKinsey or or a Bain or anyone, like just someone that's got an amazing reputation that gets you an amazing network, and then dive into the problem that you want to solve for the rest of your life. And you won't solve it for the rest of your life. You'll solve it for 10 years, but that's when you start a business, because you can afford for it not to work.
The other thing that I just want to pull out in your story is, I talk about this so often. I think there's definitely a theme with people that come onto this podcast that have become entrepreneurs, and that is the self-awareness of who they are, what they are interested in, what they are good at, and leaning into that and not persevering otherwise. I think I've heard Rory Sutherland talk about this a lot with various clips and things, that when you look at communications as a whole, it's the sort of intersection of psychology, human behavior, technology, art and creativity. And social media particularly is definitely the intersection of all those things. It seems like you also like and love all of those things, and you've lent into all of those things, and you actually took a very deliberate decision quite early on, and fair play to you for doing work experience when you're young and you're trying to impress perhaps, and you're not as in tune with who you are and what you like and that kind of thing. And, you know, people have parental pressure, and I'm sure you did too, about, you know, wanting to impress your parents and make them proud and go into medicine and all these things. But you said something fascinating at the very, very beginning of your story, which was that you didn't, maybe wrote it down, that you said you didn't have much positive energy from medicine when you did it for work experience. And that is an incredibly in tune thing to think. And that simple decision, and then realizing who you are and what you like, to then turn into art and creativity and technology and psychology and human behavior. And you find this interesting, so you're ending up putting in the work without really noticing. It's the things you're reading in your spare time, all those different things. And I think that's incredibly fascinating. And I know this links to the next part of your story, I guess. So, you know, that self-awareness and choosing to do what you like and you love, as well as what you're good at and what the world needs. And, you know, we can talk about ikigai, that sort of stuff. But I just think that's a really fascinating part of your story that I think just deserves a bit of airtime, just for people listening that are unsure how to spend their life and what they want to work on. I think trying to be in tune with yourself for what you like, if you would agree anyway. I might just be talking nonsense, but
no. Well, I kind of definitely talk about that a lot, because I had to get really, really into tune in the next chapter. But you are right that even I haven't spent enough time with my therapist to unpack this properly. But again, you know, I'm lucky enough to be blessed with two extraordinary parents and a great family. And I've actually never been, I was not like a particularly kind of confident child, but I was deep down extremely sure of myself, if that makes sense. I wasn't like a big alpha. I wasn't the kind of cool kid. I was kind of, I wasn't the, but I've always known that I want to do stuff, and I want that stuff to be great. Actually, my kind of biggest insecurity in life is what if my execution is not as great as my dreams, and that kind of but and I was a relatively kind of clear about self as from an early concept. I rebranded myself at 13, so I was dyslexic as a kid, and so I always thought I was quite smart, but I found learning quite hard because I was dyslexic. And this was before dyslexia was everything that everyone really knew, right? And then when I was about 11, one of my teachers recognized that that there's this thing called dyslexia that I should go and get tested for. And I got tested for it. And they basically said, yeah. And I had this transformational term where I worked with one lady after school every evening who was a specialist teacher. And she basically said, Charlie, you're really smart, but you learn in a different way from everyone else. And the truth is, the teachers aren't going to teach you in a way that you know how to learn. You're going to have to translate it. So all I'm going to do is I'm going to teach you how do you understand what they're teaching, and then you're going to have to translate it for your way of learning. And, you know, I was behind in English, I was behind in reading, I was behind in French and all these other languages, but I was absolutely smashing it at maths. And like, that's why I love science, because maths and science were kind of easy for me. And so I just assumed that I just wasn't very good at that other stuff. And then I actually got taught first principles of how to learn and think. And so, and I went from being an averagely clever kid to like getting, I can't remember, I got 10 A stars, something at GCSEs, I got an academic scholarship. But because I'd always been kind of in tune with maybe I'm not that smart, I really liked art and stuff as well. So I got an art scholarship as well. And so, and I was like, okay, this is interesting. So I rebranded myself as Charlie. That's when I became Charlie rather than Charles. And so everyone who knows me before the age of 11 calls me Charles, and everyone knows as Charlie. And I actually even kind of did like what do I want to be? So I had this kind of brand, kind of template.
Wow.
And then, and I was like, this is a different me now. And I loved that. That was a really kind of powerful part of my life. And even at school, I tried to get my school to change the timetable so I could do further maths biology, chemistry, and art for my A levels.
Wow.
But they couldn't get it done, so I had to drop further maths because I wouldn't drop art. And everyone was like, just drop art and do maths, further maths. And I was like, no, like I think science needs creativity, and it needs communication. It needs, like, problem solving is, like, in the world of tech at the moment, it's becoming sort of engineer centric, right? As in, like, engineering mindset is what everyone's about, and you need that for great execution. But you need, dreams and curiosity and creativity to solve big problems, and that's what Rory talks about. Like, Rory's excellent at talking about can we not overanalyze? Like, analysis and behavioral science is important, but so is a giant dollop of seeing a problem in a different way. So I guess a little bit me is always zagged when the world is zigged. So I like to be a little bit kind of countercultural in a way. So I guess that's my only answer to your question. But it kind of became much more pertinent when my life pivot happened.
It's so deliberate what you just talked about, and thank you for sharing that. I think not that everyone needs a rebrand at age 13, but to be so assured of what you like and what you're good at. But then at such a young age to actually in some way think, well, I think this is what the world needs, is incredible. And just to back that up, Belle in our team always talks about this, that it's bizarre, isn't it, that an academic journal that is reporting literally brand new science is just communicated in such a dull way.
Oh, it's almost unreadable.
It is. It's almost unreadable. And by the way, it is also simultaneously, literally, the most innovative possible thing. It's literally the coolest possible thing. It's brand new science. It's a new discovery in the world, and it's communicated awfully. Like it's bizarre, the juxtaposition and just how those two things are held at the same time. It's unbelievable.
It is genuinely. I mean, this is a whole other podcast aside, but like, I should probably confess live on your podcast that I find it almost impossible to read a paper, and I've been reading papers for years and years of my life, and I've basically got to the point where I read it in three different ways. I read, the beginning and the end to start with, and then I leave it for a bit. Then I go and look at all the pictures and all the data and say, like, what do I think it's trying to get to the data? And then I try and read it. But usually I'm less excited about it when I've tried to read it. And what I find interesting is that then I step away and I try and find someone else, like a scientist who I know, or like someone who's written the paper, to talk to them about what I think I've understood in that paper. And then you get super fascinated, because a conversation about paper with someone who knows what they're talking about is amazing. And I just don't understand why we've created this structure that creates the most boring content. I mean, I know it's a great capture of knowledge, but it's not a great communicator of knowledge.
We'll do some mutual assured destruction here, because I also confess to, I actually, should I say this out loud? I'm going to. I actually struggle to get through a full abstract. In the abstract, I go to the method and the conclusion. I actually skip the results and the intro, and I literally, in an abstract, I'll go for the middle and the end, and that's where I've got to with how I start to read papers. But perhaps Charlie's people listening to this that are earlier on in their careers want to take a bit of risk and just decide, hey, I'm going to start a TikTok channel, and what I'm going to do, I'm going to interview all the authors of the papers, and I'm going to cut that into TikTok videos and make that a lot more digestible. And actually, I'll have the first online TikTok journal for academic science and innovation. That would be
Nature Biotech on TikTok.
Nature Biotalk, something there anyway.
There's something there.
Nice. Let's move on to life 2 that you had. Obviously, an incredibly personal story. So, do share what you're willing to, and talk us through it.
So the meat of the topic. So obviously, we've talked about pre-Charlie. I was just 30 years old. I'd had on paper a really successful, I guess, life, but I'd never really thought about why I was doing what I was doing. I was just like, find something that was interesting in front of me and throwing myself at it. And on the 4th of December, 2011, I'd literally just flown back from Portugal, where we'd been at a big conference speaking. I spoke to like 5,000 people, and I flew straight in and went to another conference in Wembley, where I was kind of doing a keynote and receiving surprise. So I literally had 2 black ties because I was changing my black tie so much. It was that Adland thing. And the next morning, on the Saturday morning, I'd agreed to run a race raise money for a friend's dad who had Parkinson's. And it was it was a Santa run. So it was a 5K dressed as Father Christmas.
Excellent.
And I ran a lot. I was relatively fit. But I've never won anything. And because I was ambitious, I decided I'd try and win the race. I was like, this is probably my chance. Everyone's dressed as Father Christmas. They're going to be slow, right?
Absolutely.
So, I would try to. I was coming about second or third, and I had this kind of huge kind of pain in my head. And for literally a split second, I lost all my vision, and it flicked, and it all came back. And then I finished the race, came fourth. But I did have a category 5 brain hemorrhage, which you'll hear in a second. I finished the race and it was fine. I was talking to my wife about it, and about an hour and a bit later, I collapsed. Went straight from sort of walking, talking to in a coma, kind of frothing, kind of fitting, all that kind of fun stuff. Because what we didn't know at that point, I'd ripped the artery to my left visual cortex, which I was supposed to. There's a really interesting. I'll give you the medium length story. So, loads of lucky things happened that meant I didn't die. That's the kind of punchline. My wife called an ambulance. It arrived much earlier than it said it would, and the person in the ambulance got me to a hospital. That person had just been on a course about brain hemorrhages and brain surgery, so called someone on their mobile phone who they'd been on the course with, which meant that they sent a specialist ambulance from the National Hospital for Neurosurgery. So I wasn't in my first hospital for very long. I was transported straight into a specialist ambulance. And then they made some calls in the ambulance, like, pressure in my skull was growing quite quickly, and they needed to decide there was stuff that happened in the ambulance that should probably happen in hospitals. And my wife had to make my wife of 6 months had to make extremely big calls. Like, she was given the choice of, do we drug him deeper into a coma? And there's a chance that he's more likely to make it to the hospital, but we think there's less chance of him waking up than not waking up. And then, or do we try and kind of stabilize him now without drugging him deeper? But which means if he gets to the hospital, he'll more likely wake up, but it might mean that he doesn't make it to the hospital. So she drugged me deep into the hospital in the coma, in the ambulance. We made it to the National Hospital for Neurology and Neurosurgery, which is in Queen Square, and that's where I started the new chapter. So obviously I did all the medical stuff. I was in high dependency unit for a while. ICU, I had dependency unit, then stepped down through the different levels of care. I woke up after actually not that long, just under a good day and a bit. No one expected me to wake up. And then they started trying to work out what had happened to me. And so they looked around. I had all of my kind of brain scans, and no one could find the bleed because everyone was looking around the capillary system, because that's where people normally have brain hemorrhages, or on the surface. And then they basically decided to do a full 3D of the whole brain, and that's when they found this huge kind of tear in my artery. And what had happened is, for those that are medically interested, rather than I didn't have like a berry aneurysm. It wasn't like a little berry on the side.
Was it dissection or aneurysm? Or?
Yeah. It was a balloon aneurysm. So like it basically all the way around the artery, it effectively just stretched, like like when someone blows up a kind of kid's balloon dog. It was like that. It kind of stretched, probably under pressure or due to a clot or something. And then it effectively popped, and then like a straw, it just kind of ripped in a spiral all the way around the artery. And no one quite, and so category 5 is the level of amount of blood that you'd had. So I'd had a really big bleed, and no one could quite understand why I hadn't died. And then they found I had factor 5 Leiden, which is a kind of clotting factor, which means I clot slightly faster.
Wow.
Which may have caused the problem in the first place, but it certainly saved my life because I clotted quick. And then they said, "Oh, we need." So this is about a month into hospital, right? We need to now. We need to do some kind of intervention because it's starting to stretch again and it's going to rip. So they said the traditional route is you take the ties of your skull off, we go in there, we try and stop the bleed and come back out, but the damage will be high because you're effectively digging into the center of someone's brain. But with small aneurysms, we normally do these kind of coiled or glued embolizations. So we can try that, but we've never glued an artery shut, especially at this point. And so we don't really know what will happen. So we were like, let's give it a go. So they kind of strapped me down. I'd obviously been in hospital. I was a neurobiologist in a neuro hospital talking to neurosurgeons. I was awake for a lot of my scans. I wasn't actually awake for the final surgery. So I remember seeing 3D images of my brain on 9 screens while strapped to a table. We had a room full of people sitting to kind of watch, and they went in and they basically glued about 1.5 centimeters bung in my left visual artery going to my left visual cortex. And it's right on for those who don't have strong brain anatomy, it's the first sort of junction off your main artery. It's the artery that goes off to your visual cortex, and it literally just ripped by that junction. So they were saying there's obviously a chance if the glue doesn't set in the right place. Also, you're trying to set glue in a high pressure, blood pressure. System, like how do you make the glue not move? It's kind of tricky. So they were like, we could glue your whole artery shut. That's obviously not great. If we just glue the visual artery shut, you'll probably lose your left peripheral vision, but it's quite close to your motor cortex as well. So we might lose some, so right peripheral vision, left side of your brain. You might lose your right side mobility. So I had like a 25% chance of losing my right mobility, a 50-50 chance of keeping my kind of visual. And off they went and they did it. And it went really well. So I woke up and I could move, but I couldn't really see. So it was like a broken TV on the right peripheral. But they were saying the fact that you can see anything, it's not just your periphery's just left. You've got like broken, like white noise. It's probably just due to the trauma and the kind of oxygen and like lack of oxygen. So we're going to try and see how that works. So that was kind of there's lots of exciting medical things that I do in after dinner speech that I can tell you all about, but it's a different time. The important thing is I learned 2 extremely important things from that experience. And the first thing I learned was you only have so much energy in life. Like I was in hospital for a while and the pain was unbelievable. Like nothing I've ever experienced before. I was literally wrapped and swimming and drowning in pain. And so I was awake for about 4 hours a day. And I was just spent all of it trying to fight pain. They had me hooked up to a morphine clicker so that I could click for morphine, but they didn't realize I was allergic to morphine. And so I basically had the choice of, do I have this head pain that's overwhelming, or do I click the morphine clicker and set my body on fire? And I was just alternating the pains for a change. Because a change was better than constant same pain. And so I promised myself that if I got better, I would never waste my energy again. Because the truth is, I just bragged about what a great, impressive life I'd had beforehand. But when you're lying in bed, I was like, what a waste of time. Like, I've not changed the world for the better in any way. I've optimized social media strategies for various companies. I've sold a social media agency. I've built fun games. But have I made the world better than I found it? No. So I am going to become a ruthless investor in energy, because I looked at help well people and I thought, gosh, you've got so much energy and you waste it on rubbish. I wish I had that energy. If I ever get it back, I'm going to be precious with it. So I promised I would invest my energy ruthlessly in 3 things. 1/3 of my energy keeping myself happy and healthy. A strong foundation. I never wanted to be in a position where I was a health burden to everyone around me. My whole family dropped everything. Like my dad flew over from America. My wife obviously didn't work. My mother didn't work. Even when I left hospital, I moved in with my mum in Kent because I needed full-time care. I was wearing a nappy in hospital. I had a kind of, I called it my Gucci bag, a wee bag. Like I couldn't do anything for myself. And I was like, I have so much, I owe them so much. But I also knew that I had to make sure that I was never in a position where I was a burden again. So how do I keep myself happy and healthy? The second 1/3 of my energy was the relationships that mattered to me. So in advertising, you get really into yourself. And so I knew so many people, but I didn't really know anyone. I was kind of like social butterfly. And I was like, I want to have fewer, deeper, better relationships, because they are what matter when the shit hits the fan, and you're in hospital. It's kind of interesting to see who turns up. So that was hard. And then the 1/3 of my energy I wanted to do to undent the world. So I was saying I want to leave the world better than I found it. When I first started, I'll give my wife some amazing credit. I used to say, I want to change the world. And she's like, that's such a male approach. You want to kind of shape it into your image. And she was like, what you want to do is undent the world. You want to leave it as it should be rather than in your shape. And so I like this idea of undenting the world. And I identified 2 missions. One was brain health. Obviously, I was a neurobiologist in a neuro hospital who just had a brain hemorrhage. Brain health was interesting to me. And I think it's a completely understood and underinvested space. And then the other is earth health. So all my friends are biologists. So, and I've always kind of cared about kind of climate change. And, I grew up on a farm. I'm interested in nature. I'm much happier in a wood than I am in an office. I was like, we need to be doing more in that space. So they were the 2 kind of missions I said I put my energy in. So that was the kind of first thing I learned, this kind of understanding of kind of quantifying energy. And I've got lots of things I learned of how to work out whether that balance is working and how do I measure those things. And I've got really quite in tune with understanding how that energy balance is done. And I spend time every morning and evening reflecting and trying to measure how does that balance feel true today. And I've done that for 13 years or whatever it is. Second thing I learned was I learned from the doctors. So basically the doctors glued me up and stopped me dying, but it was the neuro rehab team that saved my life. And so the doctors literally said, congratulations, goodbye, you're leaving the hospital. Here's how you sign on to the dole. Aren't we amazing surgeons? Can we write a paper on you, et cetera, et cetera. But the neuro rehab team said, don't listen to the doctors. They don't know anything about rehab. We need to find something. We're going to measure it. We're going to try and improve it a little every day because there is so much you can gain back from brain function. But we just don't know how much and we don't know how quickly. But it's not going to be fast or fun. It's going to be years. So I took this to heart and I decided to measure my ability. So I had a bit of a read-write visual memory problem, which we fixed quite quickly. And then I had vision was my biggest problem because I had all this kind of movement on my right peripheral. And so holding patterns together and getting pattern matching up was quite hard. So they said we need to do jigsaw puzzles. So I started doing kids' jigsaw puzzles and then started doing bigger jigsaw puzzles. So I was jigsaw puzzling for hours a day for about 10 months. And I measured my ability and speed to do jigsaw puzzles. I measured my ability to walk across the side of the room. And I just tried to get a little bit better every day. And luckily I was supported by my family to do that. And Sapient, who was my employer, was amazing because I was insured. So I had income so I could actually afford to live. And so I went from not being able to see really to 20/20 vision in 2 and a bit years. And I got my driving license back. And then I went from barely being able to walk. I actually could neurologically, I could walk. I'd just been in bed for a long time, right? So I'd atrophied everything. I think I was 8.5, 9 stone when I left hospital. I'm 6'1". I shouldn't be 8.5, 9 stone. And so, but walking was hard and the pain was hard. And obviously I'd collapsed while running. So it was kind of a bit scary, but I committed to I was going to get better. So I went from, walking to then jogging, then running. I ran a London marathon after 13 months of the year after leaving the hospital, so 13 months after leaving the hospital. And I kept going until I was running London to Brighton 100-kilometer ultra marathons where you're running, 13 and a half hours nonstop while eating while you're running. And it's not because I'm an extraordinary athlete. It's because I committed to get 1% better than I was yesterday, every day for 5 years. And that way you can get really, really, really good at anything. And that's what I guess second thing I learned. And it made me realize that 2 big things. One, we're all suboptimal. Right? We all don't understand what we can do with this thing in our head. It's extraordinary. If we commit to it, we can achieve extraordinary things. There's this lie that we've kind of taught society, which is that you're born, and some people are born with big brains and some people are born with small brains because they're like buckets, right? And if you've got a big brain, you fill it up with knowledge at school. And then when you finish school, you use that knowledge to be true to yourself for the rest of your life. There's this fixed thing called self that you need to find and be true to. It's all crap, right? You're changing all the time. You can learn all the time. I'm changing your neural systems in this conversation and you're changing mine. And if we can embrace the idea that our self is changeable and adaptable and designable and improvable, we can achieve amazing things. And whether that's my dyslexia as a seed to that, whether that's my interest in kind of curiosity in academia and science, or it was the brain hemorrhage. But the brain hemorrhage made me realize, wow, imagine if we could make everyone in the world 1% better, just 1% better. We'd make better choices. We'd treat each other better. We'd be more considerate. We'd do less stupid things. I know that's a kind of optimistic view on the world, but I was if we could just make everyone think 1% better, it could have a massive ripple effect across society. And so I became a bit of a bore in self-improvement, right? And so that's when I kind of went back to work. I quit my job on my first day and said, I'm sorry, this doesn't align with my values, which was a big deal because I walked away from a lot of my earn out. For those who haven't sold businesses, you don't get the money up front, you have to earn it out. And so I walked away from quite a lot of money. And then, but it didn't align with what I was doing anymore. I was still quite ill. I tried to start a business in brain measurement, but was still too ill with my neuropsychometrician. I did some work with a friend of mine who was starting up businesses, but I wasn't doing. But I was a bit unwell in that space. But then I met Dame Zareen and Anne-Marie Hooby, who are probably, other than anyone I'm related to, the people who've been most influential in my life. They were the founders of Just Giving, and they taught me the missing ingredient in my entrepreneurial journey, that I always believed that you made money doing what you did at work, and then you used that money to try and do good stuff. Right? That was kind of the 80s model of like capitalism, right? Make money and then like give it away to charities. And what Just Giving made me realize was this, if I had a philosophy of continual personal improvement, if we could put all of that energy into organizations that were entirely focused on impact and saw money as a fuel to deliver that impact, so this for profit, for good kind of B Corp movement, you can change the world quickly and at scale. And so I joined Just Giving as their chief marketing officer. I drank the Kool-Aid. I then became their chief operating officer. And I got to work with Dame Zareen and Anne-Marie, who I call Boss 1 and Boss 2. And they're very precious people to me, but they are also probably the biggest pains in my arse of anyone I've ever worked with. I'm sure they won't mind me saying that.
I'm sure they won't.
And they kind of taught me a different way of looking at the world and at capitalism, to be honest with you. So, and I genuinely thought we were going to fix capitalism by redistributing wealth through generosity. That was kind of what we were all about.
Yeah.
I'm proud enough to say we raised $5.8 billion for charities and good causes while I was there. We grew it from, I think we were just under 1 million registered users when I joined. We grew it to 38 million registered users. We launched it in 3 other countries. Well, one of them not so well. We launched crowdfunding. We did all sorts of things. It was a really fantastic time. And I probably would have worked there for the rest of my life, very happily, because I thought the impact we were making was huge. And I had lots of visions of what we could do with that. Don't get me started on money, but I think capitalism is a little bit broken. And so I thought actually reciprocity and generosity are biological traits, 2 of which are in the rules of kinship. When we look at ants' nest systems, they have reciprocity and generosity.
Interesting.
And so I was like, but our technology and our kind of capitalism has not kind of set up to optimize that well. So I thought if we can build that into our system, it might make a better system. And then in 2018, that got sold to Blackboard, which is an amazing home for it. Like a really great technology company. I had the great fun of like going on the roadshow. Like everyone was trying to buy us. I got to go meet all sorts of big tech companies. I met some of my old friends again. And then, but we decided to sell it to Blackboard because they had deep commitments to charity sector, and they worked really well with the charity sector already. And it was the world's largest B Corp exit at the time. It got sold for like £105 million or something, which was kind of cash, and it was entirely bootstrapped. So we never raised any capital. It was owned by 3 people.
Wow.
And so I'd learned 2 things. I'd learned like how do you do a mission organization, but also how do you run a tech business on a shoestring. So like we genuinely, every cent of like money we spent very consciously, and then it was always an investment into trying in growing giving. And like we were very lean, and that was very uncool in the tech world over the last 5-6 years, where it's been like burn money and grow fast. But I've always been a believer in like have a strong mission. Like the mission deserves respect, and the money you have has to work hard to deliver that mission. And it was amazing. But that then obviously set me up. So like we talked about luck earlier, right? I then had the opportunity to stay working with Blackboard, but actually it was our chairman at the time, a guy called Jonathan, said, Charlie, like you've always been interested in self-improvement and it's been your thing. Like spend 6 months and just get really interested in what's the problem you think you can solve in that space. Like don't try and come up with an idea, don't start a business, just spend 6 months like drinking in the problems and become obsessed with them. And so I left and decided I was going to be an angel investor, and I was going to start brain tech companies and tech companies. And I just spent 6 months really understanding the problem space in brain tech and in Earth Health. And I did quite a lot of investments in sort of brain hardware, and I kind of looked at brain molecules, brain hardware, and then, but was really interested in trying to find something that helped every self better. Right? That was all about like, how do you do continuous personal improvement? And couldn't really find anyone. Even the big American therapy platforms were very much about just like, hook up to therapy for life, subscribe to therapy. And I was like, I don't want people to do that. I want people to get better forever. They shouldn't be in therapy. No one should be in therapy. We should all be awesome. Therapy is a way of getting us to better. It shouldn't be our kind of always on function. And so I ended up sort of reluctantly being a kind of founder, I guess, in a way, because I couldn't find anyone solving the problem, and I thought I could solve it. And that's when HelloSelf started and all the new people started coming into my life. So I guess I'll pause there. Any questions about that phase of my life?
I was going to say one of the gifts of doing this podcast actually is hearing life lessons that I take forward and adopt into my own life. And I think your framework that you discovered after your brain hemorrhage, that you start with yourself, making yourself happy and healthy, that gives you a strong foundation. Next, you focus on the relationships that matter to you. Next, you then want to undent the world, and you've chosen what aligns with you: brain health, earth health, and all of that is to drive, I guess, your energy in a positive way, both positive coming back to you, so you feel positive, but then you are creating positivity back into the world, and you create this sort of positive feedback loop, I guess, where you then have the energy to keep doing good, and that good fuels you. It's really, as I say, a gift, I think, hearing things like that from people like you, because I get to adopt those things, and I get to do so without having the adversity, I guess, of what you've been through. And I guess it's a thank you, really, that you can explain that to me and the listeners here, that you can go through something as powerful and as life-changing as a brain hemorrhage, and you can come out of the other side with, I guess, a phrase that I've heard a few times on here, which is the privilege of adversity, that you've actually gone through that adversity, which has kicked you into a life that serves you well and serves you better and makes you happy, makes the world a better place. And I think reaching a framework that you've got to there is, I think it is obviously important for everyone if they can get there. I think very few people will be able to with the conviction that you have. And that's for me, that's a really wonderful thing. And I think you mentioned it yourself, that we're interested in, how can I make my life better for me? I feel sad, I feel down, I feel this, I feel that, and I need to change this for me. And I think there are certain cultures that when you're feeling like that, those cultures encourage you to look elsewhere, and they encourage you to help others as a means of helping yourself. And I don't think we have that culture in the UK. Not that I am receptive to anyway here. I think I fall to this as well very often, that if I'm feeling anxious about where I am, I'm looking to the things that will make me, or maybe I need to go and play tennis, maybe I need to go and do this, maybe I need to go and do that. And it becomes very self-centered. And I know instinctively that what I should do is not do that. And again, that can be explored. And we all have this sort of, Rory Sutherland even talks about this, we all feel like we should do something, and that's quite powerful. As an internal compass. But I think, as I say, your framework is wonderful there, and it's a gift that we can all hear that and learn from something as frankly devastating as a brain hemorrhage that nearly killed you, like calling a spade, and we all will not have the ability to learn in such an acute fashion. One thing that did really interest me in what you talked about was very much linked to that, the reciprocity component here. I think we're fortunate in health tech that a lot of what we do, we feel like we're making improvements to the world. And I think that's really important. we have to do so within a capitalist framework. It's why a lot of us become founders, because you're right, a lot of us are reluctant founders because we spot a problem and we have to act within the system in order to go and solve it. And at the moment, that looks something like conscientious capitalism. Reciprocity, you talked about, is actually inbuilt within us. It's inbuilt within communities. We see it in ants, we see it in humans, but yet the system is not quite set up for that. Capitalism isn't quite capped in the right areas. It isn't, policy doesn't surround the capitalism that we currently have in order to incentivize that. And I think we all suffer because of what I've literally just talked about. We enter this very self-centered nature in order to solve problems, whereas actually, if we were to look more to the community, perhaps we could solve them more broadly. Maybe it's not a question, maybe it's just a comment, but I feel like what you've done there is just so much of what I've thought about in a very non-eloquent way has collided. And your eloquence has, I guess, given me a heck of a way of explaining that, even if in just this brief moment that I will never be able to explain again. But I think that has been a wonderful, wonderful lesson for me. And I, and I don't want to labor the point, but I'm sure it was for you.
Because we don't want to talk about kind of capitalism too much, but like the short version is like, it's completely understandable that when we build a system that obviously is about kind of reward, which capitalism is, that we should be very good at the building up of kind of wealth and capital. So, it's the kind of competitive element, the sort of Darwinian evolution kind of and we've done very well at that. Capitalism done some amazing things in that way. But capitalism was built in a kind of nation state model. And so they basically said, okay, how are we going to do this redistribution stuff? We'll do it through taxes, or we'll do it through the third sector, which is charity. And even just the fact it's called the third sector is means it kind of comes third, right? And so actually it's the redistribution part, charities and government, should be at least as important as the wealth creation part. But the wealth creation part, we've been working on since 70s and 80s. We haven't really cracked what does the redistribution part look like, because nation-based taxes systems are less impactful than they used to be in a kind of global world. And also it's a false construct that's been shoved on a kind of human system. Whereas reciprocity, generosity is, as you said, we are genetically trained to be generous, right? There's all these, and so if we could work out how do we unlock third sector style generosity, but at a scale that has the same redistribution impacts as the concentration of wealth is created through capitalism, then you fix capitalism. But that's
the SEIS scheme, maybe is that a version of it? If you restrict SEIS to B Corps, maybe.
Yeah, I'll have a chat with the Chancellor next time.
Whoever the new one is, yeah, exactly.
I think we're fairly stable now. But let's not do politics as well.
Let's not do that as well. Yeah, exactly. That's another one. HelloSelf. Let's do some health tech in the final part of this. All of this culminates now in what feels like your purpose, and so how is everything that we've talked about so far built into what is now HelloSelf and delivering value to people broadly?
So I was spending a lot of time trying to work out, how do I find a service that can help everyone get a little 1% better every day? You just heard it in my values. And I couldn't find anyone that did it. Found lots of services that were offering access to therapy and kind of coaching, but there wasn't much measurement and there wasn't much understanding of self in it. It was just it was service purchased, right? And so I started trying to look for interesting models that could kind of that could be a business. So it sounds great, we want to make everyone better, but we really need to make something that someone is spending money on better to start with, because we didn't want to create a whole new category. And that's when I was lucky enough to bump into Dr. Amina Taylor, who I guess is the closest thing I have to a co-founder. She was actually my brother's best friend at school, and she'd just been winning lots of awards in the NHS she was a clinical psychologist, and she was building kind of innovative pathways for psychosis at the Maudsley. And she'd got a position on King's Health Trust doing healthcare economics and stuff. So she was a new thinker in the kind of space of how do we deliver better. And her big thing was, we need to measure outcomes better. We need to understand outcomes in really good ways, and we need to think about outcomes-based value rather than value-based healthcare. And so she was trying to solve this kind of problem for a very specific group, and I was trying to solve it for everyone. And we were both talked about the fact that there are about 1.8 billion people in the world every year that could benefit from some psychological advice. So that's kind of mental health, but also people who've gone through unusual psychological experiences, extreme stress, extreme grief, difficult childbirths, etc. That's a lot of people. And there's never going to be enough therapists, right? And like, we're not going to suddenly make everyone in America trained to be a therapist. You need about 300 million more therapists to treat that group. But we do need people to understand, some new psychological knowledge. And so everyone's answer to this has been like self-help or like books and CBT books, etc. But we're all different, right? James doesn't want to be Charlie, and Charlie doesn't want to be James. We're starting in different places, and we want to end in different places. So the idea that we all need the same psychological advice feels wrong to all of us. We need personalized psychological advice. But how do we do personalized psychological advice at an enormous scale? And I was trying to solve that for the kind of everyone, and Romina was trying to solve that for what is effectively an edge case, a psychosis audience. It's like a more extreme edge case audience, but where there's lots more complexity. And so we came together and we did the rather pretentious 4-step strategy to change the world, the kind of Elon Musk napkin, where we basically said the first thing we need to do is we need to create the world's most trusted brand for personalized psychological advice. So we want to kind of almost reinvent therapy, but not in a super disruptive way, because the last thing that people need in this space is disruption. And that what they need is kind of support. So
trust. They need someone somewhere to trust. They need an entity to trust for information.
Yeah, trust is literally, we measure trust and everything. NPS and trust is all like is our kind of.
How do you measure trust out of interest?
Well, I'll come to that in outcome measurements, but we actually we asked 3 questions: how cared for do you feel by the platform? How we then ask how much do you kind of trust the HelloSelf system, and then we ask and how likely are you to recommend HelloSelf to a friend? That's the typical NPS question, and we kind of and then we also ask like how much progress do you feel like you're making? And what's interesting is the more people trust the platform, the faster their progress. So there's all sorts of things. Anyways. We'll come into that in a bit. But, so we came together. That was the first step. And we realized to do our first step of building the world's most trusted brand, we needed to build a product that could not just disrupt the ecosystem, but could serve the ecosystem better. So we had a 3-sided network, effectively. We have a product for our members. They're the people we treat. Some people call them patients. We call them members or clients. Where the person is trying to improve, because we believe that they should be in charge of their self choices, and we want them to have the tools to be able to make themselves better. We don't do things to members; we give them advice, and the members then decide what they want to do. Obviously, we have a product for therapists, which we start off with ClinPsychs, went to CBTs and counselors, various others, and so therapists can use it almost like a vertical SaaS. Right? How do you make therapists more efficient? How do you help them measure outcomes all the time? How do you help them make better clinical decisions? How do you help them work in a more connected care model? All these sorts of things. And then we have a kind of face of the product, the third side of the network, which goes to what we call the care team, the connected care team. So psychiatrists, GPs, friends and family, anyone who is kind of interested in that person's care, because connected gold standard care is connected, right? People are in a social system. They might need to bring family members into that system. They might need to bring their GP, their psychiatrist, and we want to make sure they can participate in that experience in an appropriate way. And then in the private, in residential NHS mental health institutions, there's obviously lots of connected working. But as soon as you get into the private system or outside of an inpatient in an outpatient model, there's very little communication going on between psychiatrists and psychologists and GPs. And so if you can get that to be a bit more coordinated, people can get better faster. So that was the first step. And we said all of this has to be optimized on measuring outcomes and getting people better faster and keeping them better for longer. So we had this kind of idea that no one should be in therapy, which is quite odd for a therapy business, right? As in, we should get people through therapy and graduate them into self-improvement. So we don't like this idea of treatment, discharge, relapse. We treat, we're improve, graduate, and then constantly maintain and
prevent.
And that was the first step. Second step was to change psychology into a data science. So psychologists are wonderful people, but they're on the artier end of the scientific spectrum, and they're actually mildly intimidated by big data sets. But behavioral data is everywhere now, right? There's so much of it. So how do we take behavioral data, the Rory Sutherland kind of world, behavioral information and psychological information, and bring that together to make better therapeutic decisions and clinical decisions? And we call that the science of self rather than psychology. And then we wanted to use all of that to create Self AI, we called it, which is codenamed Project Happy, and which was about like how do we build an AI that can help understand someone's present self shape, also understand their desired future self shape, and help understand what is the best pathway to get from where you are to where they're in the future. And that's effectively an AI life coach in a way. Now we always said we never would be able to, well, whether never is too strong a word, our intention wasn't to remove the human relationship from therapy. It's very important, but it was to try and work out like how can something work with you every day between sessions? Because you don't get better in a therapy room. You have to learn something in a therapy room, and you have to practice it, and you have to remember it, and you have to apply it to your life every day. And it's that applying it to your life that's hard. Like the 1% stuff that I had to do every day is the hard bit, right? Calling my therapist once a week. If I don't do what they recommend, I'm not going to get better. And so we were like, how do we use the AI to actually kind of implement change and help people understand themselves better? And then eventually, once people are out, then they can keep working with that AI to keep them well. And then the fourth bit, where it's scare everyone, we're 15 years away from a world where we'll be able to digitally design ourselves. So we'll be able to, whether it's a brain-computer interface or a neurofeedback or something. And so there will be a Facebook app platform for your mind. And in that world, there are two interesting questions. One is, who am I? Like the ultimate religious question. Like, who is the person making the choice to change this person? Is it the person before they've made the change or the person after they've made the change? So there's some really big ethical and philosophical questions in self-improvement. And then the second question, which is actually my favorite, is who decides who I am? And like different cultures have different answers to that question. So do I decide who I am? Does society decide who I am? Does my family decide who I am? Does the government decide who I am? And does the services that I purchase get to decide who I am? There are lots of interesting kind of questions. And of course, the reality is we change all the time from all of these things all around us, but we have a sense that we have control over that, even though we don't. But when you can rapidly change yourself, how does that choice happen? And I know that in that future, in 15 years' time, there will be a new type of economy, because if we spend a fortune on clothes and cars and social stuff to try and project who we think we are to other people, if we could spend money changing who we actually felt we were, that will be enormous. And it won't be medicine, because it won't be like a medical intervention, but it also won't be a free-for-all, hopefully. It should be regulated in some way. And so I suspect there'll be this more like this self-designer-like experience where you'll need to go to someone and say, here are my hopes, my dreams, my thoughts, my secrets. Here's some money. This is who I am, and this is who I think I want to be. Can you help me understand that choice? Like, is that a good choice or is that not a good choice? And if that is who I want to be, how do I become that person? I want completely independent advice that is not affected by any other choice that can give me that, almost like that doctor relationship where they have to give you. And at the moment, that relationship exists with your therapist, right? That you go to them and you say, here are my hopes, my dreams, my thoughts, my secrets, and some money. Can you give me advice on how I can improve? And so hence we started with therapy as a model, because it creates the right trust relationship between us as a service and the member. But our ultimate ambition is to help everyone apply any technology to becoming the person they want to become, but with that same level of trust and curation and control in your hands.
Yeah.
So that was our super long journey. We're obviously relatively early in that, so I can tell you about where we are today. But that's the big vision.
Yeah, it's not just a therapy marketplace, is it? It's not just it's far more sophisticated. I think that's I guess where I want to start, because the the sophistication of it goes beyond just the technical nature of the platform. It goes to obviously the different people that you want to involve in the business model, but it actually talks to, like you've done multiple times in your career, your view for the future and where this fits into a view of what the world is going to look like. Because I think that's what's going to give you the ability to grow as the world changes, if you're anticipating those changes. One thing you talked about very specifically was that within what you say is roughly 15 years, we're going to need to we're going to have the ability to digitally design ourselves. There'll be an app for our mind. Are you talking there to the fact that there will be somewhere where our traits are essentially documented and we can have an impartial view of what our mind and our personality actually is, and therefore we can identify that and identify where we want to change? Or are you talking about something different there?
We could go really deep down here, and we need to be very careful when we're talking about sort of science, fantasy, and science. And the science, fantasy, science fiction, I still believe to be true. But look, okay, what can we definitely do today is probably a good place to start. So what themes will happen? Psychology and neurobiology will come crashing together. So neuroimaging is getting cheap, it's getting high resolution. So we'll be able to very soon be able to say, okay, when you think X, these are the exact neurons that are firing in that space. And you'll be able to do that with earpieces rather than with massive head scanning equipment. I'm invested in a company called CoMind in the UK, which is doing some extraordinary stuff with brain imaging. And there are, if you look on the internet, there are Apple's got patents for putting EEG scanners in your Apple headphones, so you can get there's lots of interesting stuff that's happening in that space. So you'll be able to correlate like what's firing with what is your experience at the time of that firing. Then so that's part one. Part two is, can you recreate that experience? And so we've already got the ability now where you can use sort of fMRI to re-trigger certain clusters of neurons to refire. So you can kind of measure it, say these areas are firing, let's kind of cross over the lasers, put enough energy into that system so you can get refiring of certain neuron systems. It's effectively kind of neurostimulation, but with hyper-targeted. And when you do that, you start getting kind of almost ghost experiences of what happened before. So you can see a picture, we can measure it, you can then come away and you can people don't see the exact same picture again, but you can kind of re-trigger the same kind of shapes in the same way, which means you can start recreating reality in people's heads. And so if we can do that a bit today, I mean, in 10, 15 years, it will be extraordinary. And if you can recreate reality, the way that we learn, like the way brains work, is they experience an input, right? They correlate that in different ways with other different outputs, and then they store that information in some way. And we learn by repetition. So when we're playing the piano, we have to do the same thing over and over and over again until our brain understands the pattern. If we can do that same, like download 1,000, it takes us 1,000 hours to do 1,000 times. If we can take that 1,000 hours and do it into 1,000 seconds, because we can just rapidly stimulate the brain over and over again, can we learn by doing effectively false stimulation? And so everyone thinks, oh, there's going to be some kind of digital plug into your brain. I actually don't think it will be. I think we'll basically use neurofeedback as a kind of technique, but really fast neurofeedback, hyper targeted at an individual neurological layer to learn things. And so that means we'll be able to learn new skills. We'll learn new associations between thoughts and feelings. Like most of therapy is about understanding your behaviors and your thoughts and emotions and how they interact and trying to restructure that and restack it. But we'll also learn things that we don't know about, like, so how does our neurology affect our personality traits, and how does it affect our choice making, and how does it affect our propensity to risk? And so that's how we'll be able to start adjusting our personality, our self. And whether it happens in 5 years, 10 years, 15 years, 50 years, I don't know, but it will happen.
And I believe you if you have that much conviction. I think then your point becomes incredibly pertinent, which is then who's in the driving seat for that. And it is a very philosophical question, because who is the I? If I say I need to be less angry when I play tennis, who's the I in that scenario? If I hit a bad drop shot that goes straight into the net and I say, oh, you shouldn't have done that, who is the I and who is the you? And it's interesting because we have these different versions of ourselves, and thinking fast and slow is probably like an obvious framework for it. That we have the fast survival brain and the slow, more logical brain, and that side of things. And I guess other cultures might call it the ego and something like there's lots of different frameworks, I guess, and where neurology, psychology then blend with philosophy just becomes incredibly interesting. And all of a sudden, for me, it hits this sort of exponential of like, now all of a sudden, like we've taken one step forwards, and all of a sudden I've just fallen off the edge of the cliff in terms of like how much my mind just cannot compute how we would even go about putting this into a framework to make it useful. You've probably done a lot more of this thinking than I have, but I don't know where the world goes when you start doing that, because it's easy to think about a race of incredibly wealthy superhumans that have taught themselves grade 8 piano, and we can extrapolate that to quite dangerous things as well if we wanted to, because we know how humans are. And then there's other people left behind. So there's a wealth gap thing there, and there's a it used to be digital poverty, and now it's some sort of like crazy hardware, software skill poverty of brain. But like, I don't know. There's as you can see, my mind gets chaotic when I think about this sort of stuff, and
it's fascinating. I guess the good news is you're exactly right. Like all of these things will start coming at us. The kind of bad news is we've been thinking about it in religion since society began, and we've still not come up with any answers yet. And the other bad news is it's going to come at us way before we can think through the answers. So much like the speed of it's fun. There's a great book. The good news is there's lots of good thinkers doing good work around the world all over this. So there's a great book called The Battle for Your Brain, which is written by a lady whose name I can't remember right now, but it's up there, who I've met a couple of times. And there's a lot of work being done in the UN with the UN about like, how do we do brain safety? How do we keep brain privacy? Like how do brain data get treated as differently? So she's just a lawyer thinking about what are the legal frameworks we need to protect self and brain data. But then at the other end, you've got policy thinkers in more of the kind of Neuralink space who are saying, actually, the way that humans don't get beaten by machines in an AI world is arbitrarily we think of ourselves as individuals where we should just network our brains, right? And actually, and we should become network individuals. And so actually self won't exist as a concept anymore. Society will become the important things, and your tribe will become things, and the idea of
probably the answer to quite a lot of problems that we have at the moment. Society, but they also community.
But these are like multi-generational debates that will probably hit us because some young tech person in a garage somewhere has a breakthrough and decides to sell it as a VR gaming platform headset, which is where most of these companies are starting, and that's scary. Or a military hardware company.
It is, and pulling it back into the realm of reality and where we are currently, before we get too carried away. HelloSelf. The interesting part of your business model there is, for me, you call it graduation, which I think is wonderful. The way you've actually put language front of center and in multiple parts of this are really interesting to me. The fact you call patients members, not patients, that's not your default, and actually you're adding in layers through language here that allow for barriers to fall, I think, for a lot of people, and to allow for inclusion. And I think you and I will agree that language is far more important than people give it credit for. And people think, that calling a newsletter Healthtech Pigeon is just a funny quip. Actually, it makes it a lot more easy to open an email from a cartoon pigeon, because I know that you sign up to newsletters with a personal email address, and I know that I'm sending you this on a Sunday. You don't want anything in work language. You want it to be humorous. So I know that it increases my open rates calling Healthtech, and that's just purely a language play, and it's not just a stupid thing. And actually, calling patients members, I imagine you sat around a table for quite a long time. You're thinking, what are you going to call people in this? And language is just so important here.
And in therapy in general. So it's two interesting things about language. when we started the business, we did some obviously testing, and we took exactly the same proposition and called it psychological coaching in one card and called it therapy on the other card. And what was interesting, 2 out of 10 people in the UK wanted to buy therapy. This was in 2018, so quite a long time ago. But with exactly the same card, the same information, with just the word therapy changed to psychological coaching, 8 out of 10 people.
Yeah, it's fascinating. Yeah.
So that was just a kind of stigma of language. But the other interesting thing about language, a bit academic, but you have to get into the history of science to understand this. So again, apologies if I insult all psychologists on the call. So psychology is a really young science. Right? It's a compared to sort of astrophysics, we haven't been doing it that long, and because it's a relatively young science, it's also really complicated to study, and like because we're trying to understand sort of humans and all this elements, and so it's kind of got sort of less sort of hard sort of data structures, but it was also the newest science in the block. So the maths and the physicists have been around for ages, and then you get the kind of the biologists and then the psychologists, and science has got this really odd hierarchy that shouldn't really exist, but it does. So some people think of the older sciences as being kind of deeper, stronger sciences. And so what you find is all these new sciences have to kind of create their culture and their language. And so you get these tribes. And so psychology is still fighting. You've got this kind of psychotherapy tribe, which is all about psychodynamics and natures. And you've got the psychology tribe, which is all about sort of measurable outcomes. And they're both in a relatively young science, so they're also trying to kind of create the language and framework that make them other. So the whole point of the science is to go like, I'm a specialist in this and you're not, so I've got a language on it. But that's the opposite of what someone who's receiving care wants. They don't want it to feel other, they want it to feel understandable. So we have to kind of constantly fight about we can't use the language of the science, we have to use the language of the member. And so the members would call themselves members. They don't say psychology. They talk about their self, which is why we call ourselves HelloSelf. They don't talk about like their PHQ-9 scores. They talk about like how does their stress feel? How does their anxiety feel? Or do they feel depressed? And they actually don't come to therapy because like they want to reduce their not to be depressed anymore. They come to therapy because they have some kind of goal in their head, like they want to feel happy, or they want to be able to go to work, or they want to be able to hold down a job, or be in a relationship, or leave the house, or not like feel so angry the whole time. And actually, if they could measure that, that's what they care about. They don't care about the kind of clinical outcome score, but the science around it is created to try and create otherness, and then B, to create a system that's sort of operationable. None of which the members care about. And actually, the way that we've built it is, as in the way that society has built psychology over the last 100 years, is really been about the scientist and the system, not about the person who needs to get better. And if you flip that around the other way, you get to different answers.
Beautiful. And one of the key components of this is this graduation that you're expecting people to do. You're sort of creating a model that means at some point they no longer take that therapy and actually they move on to something else. It's a concept that I don't want to be disruptive to members or patients, but you might want to be disruptive to some of those companies that incentivize you to stay in therapy for the rest of your life. So it seems disruptive from that way.
Yeah, like I mean, what are we today is probably a kind of good dominant. So today we're a therapy service. You can get referred by certain NHS trusts. We work with a lot of insurers, we work with lots of GPs and psychiatrists. So we kind of handle lots of interesting complexity. But also, people can just sign up. And actually, about 25% of our members come because someone they know or love has used the platform and they've recommended it to someone else. So they get this kind of big word of mouth engine. People come into the platform, and we effectively, first step is to kind of get them on board and to help them understand themselves a little bit. So the first thing is, most people go into therapy and they don't see anything. They don't see any numbers. Like we say, okay, you're probably going to measure a core, a GAD, a PHQ. Let's explain to you what those are, and you're going to see those graphs. They're going to be your graphs. And actually, there might be other things you want to measure, like how you're feeling. What do you want to measure? So we kind of help you set up this understanding of self. And in the medical world, they call that triage. But triage gets done to someone, right? And then it's hidden by the doctor saying, "I've got your triage results." But we don't know. We kind of say, "Here, we're just going to give you lots of information so you understand yourself better and understand what you need." That's the first stage. The second stage, we then say, like, okay, if you want to work with a therapist, let's make sure you work with the right one, because it makes a big difference who you work with. And so we match you to the right therapist. We have a clinical team that does it. We have algorithms that do it. We have PhD clin-psychs. We have CBT therapists. We have all sorts of different kind of mix of different specialisms. And we match that on personality, attributes, clinical skills, all sorts of things, availability, all sorts of things. So we make sure you find a therapist that you're going to work well with. And then we make sure that introduction's done well, because the relationship has to start well. It's like a dating app, right? Like, you don't just get thrown into a room and say, hey, get on. Like, you have to kind of get to know each other. Then we get you better faster, about 40% faster. So if you use the technology, you'll get through therapy, you'll get through to an outcome about 40% faster, which saves you 40% of your cost if you're paying for it. But what's interesting here is we're probably the only therapy company in the world that's trying to make therapy more effective, because we get paid for the number of hours that you sit in a therapy room. So most therapy services are perfectly happy for you to sit in a therapy room for 2 extra hours, because they get paid. So we're actually kind of working against our model at the moment, because we actually are reducing the amount each customer pays with us, but we're getting them better faster. And the way we do that, as you said, is by helping people remember what happens in their session. So we have sessions happen on the platform, but there's lots of tools to kind of capture and note. And we do like summaries and transcripts and highlight reels and all sorts of things you can do to watch back what you learn. Because, I mean, for those who haven't been in therapy, it's stressful being in therapy, right? You talk for an hour, it's a really emotional conversation. You leave going, that was great. And then you go, actually, I can't remember half of it. And so actually reflecting and remembering and working on what you learn is important. And then the second thing is you have to practice what you learn. So you don't get better in the room. You have to apply it every day to your life. You have to do your homework. And like everyone knows, from exercise to physio, like no one does their exercises, right? Like you come to the physio next week and say, yes, I did my exercises. You haven't done your exercises. And so you don't get better faster. And if you do your exercises, you get better much faster psychologically. It's just boring. And that 1% every day is a bit boring. So the app helps you do that. And that gets you better faster. And that synchronous and asynchronous, all the stuff you'd expect with a kind of good teletherapy platform. And then, as you said, the last step is, so the fourth step is graduation. So we want to get you out of therapy fast. You've got way better things in your life to be getting on with than sitting talking to a therapist for an hour a week. Let's get you out of therapy fast, and then let's capture all of the things that you've learned, all the actions, the activities, and let's put those into a plan that you can manage going forwards with our technology. And so we graduate you to the self plan. And then you have the idea of kind of checking in. So we have this idea of check in with yourself, where you basically have these moments where you book some time and you go back and you can reflect on how you're feeling, how you're doing. Are you still doing the stuff you learned in therapy? You can measure some stuff. And then that allows us to kind of almost keep a track on whether you're kind of getting up or down. And if you're going down, we can give you new advice automatically or through the platform, which can then get back on track. We can remind you of advice you've had previously, which can obviously get you back on track. Or if worst case scenario, we can turn and say, well, let's just call your therapist back and have a 1 hour session, because then you won't have a full relapse cycle. And so we're trying to get relapse from around 50, like the heartbreaking thing in the NHS, about 56% of people will relapse within 12 months in an IAP service. And which it's a revolving door, right? Like that means it's only working 50% of people. Ours is more like 4% at the moment. And so obviously we haven't got longitudinal enough data to make that clinically valid, but like we're trying to work out how do we not just make it from 50% to 50%, we're like, how do we effectively almost get rid of relapse? Because in theory, once you understand how to work with a therapist and once you understand yourself, you shouldn't ever go back all the way to kind of crisis mode. You should be able to do maintenance top up. The problem is it's very expensive to deliver that way, and the NHS can't deliver it that way, because you can, if you're doing it with humans, because they've got such a massive waiting list of people who are in the crisis mode. But if you can use technology, the cost of maintenance goes down dramatically, and then you can transform society, because then you can unlock the backlog, release lots of therapists' capacity to treating new people, and you can eventually save the world. So that's what we're doing today. And at the moment, step 1, 2, and 3 are working fantastically. And then we're still in kind of interesting trials. We're doing a clinical trial at the moment, actually, to try and work out like what's our kind of best relapse prevention model. So we're changing our kind of check-in models post-graduation quite a lot to try and work out like what helps people stay well the longest.
Beautiful. Charlie, it's been an absolute pleasure having you on the podcast. We've covered a lot of ground today. I mean, everything in your background, obviously the personal story. We talked about language and communication, psychology, behavior, art and creativity. I mean, there's loads in here. Final question. Are you enjoying it? Are you in a place now where you're happy, healthy, and enjoying what you're doing, what you're building?
I really want to just answer the question with yes, because we were here, but I don't optimize my life for enjoyment. So one of the strange things I decided when I put my mission focus on was that I was going to cut fun, right? So I'm not that interested in fun anymore. So do I feel fulfilled? Definitely. Is it hard? Unbelievably hard. One of the hardest things about my job is I technically have to be the psychologically wellest person, but I have probably the most stressful job I've ever had, right? So there's like a contradiction, like you can't be an unstressed founder. And I feel frustrated that we're not helping enough people. I mean, we've treated 12,000 people this year, right? We're getting there, but I want to be helping millions of people. And so if obviously any listeners out there that want to talk about how do we transform kind of outcomes for everyone and make every self better, I'd love to hear from them. But like, I'm an impatient person. Like I know we can help a lot more people faster. So I guess growth is the thing that kind of makes me frustrated. But would I change it? Absolutely not. Like, am I still passionate about it? Yes. Am I still as curious about self and self-improvement as I ever have been? Absolutely. And will I ever stop doing it? No way. You'd have to drag me away kicking and screaming.
Beautiful. For those people that do want to learn more and find out, what's the best way for them to do so?
Ping me on LinkedIn. It's always a good way if you want to come direct to me. It's my favorite channel. Or you can obviously go to helloself.com if you want to have a look at the service and where you can get all of the kind of contact information.
Awesome, Charlie. It's been a long one, but it's been an absolute pleasure. Thank you for coming on.
No problem. Thank you for having me.